Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is Mary Lenzini. She is the president and CEO of the Visiting Nurses Association of Connecticut. Her first time on the show, so first of all, welcome to the show.
Thank you very much.
The Visiting Nurses Association, we're going to get into it, but first, let's start by clearing up a misconception about it, because I think people get confused about the organization, what it is, where it covers, and that sort of thing, correct?
Sure. Our name alone, the VNA or Visiting Nurse Association, sounds like we're a big trade organization or membership organization, when in fact we're a certified home health care company, not-for-profit, and we don't have a connection with other VNAs, except that we all work side by side.
But there's more than one VNA in the state, right?
Yes, many VNAs,
Okay.
not only in Connecticut, but across the country.
What is the reason for that? Is it because you super serve just a certain area of the state and others do the same, or?
There really isn't any rule that says we can't cross lines or do
Turf
anything
wars.
like that. No turf wars.
No.
But usually we establish, for instance, we're established here in the Lawrence Memorial catchment area.
Right. All right. So let's kind of talk about what the VNA's mission is and how did it start out? I want to go back in time to a point before there was a VNA and somehow it was decided that the VNA would be a good idea and it's necessary.
Well, that's a really good question. What has happened here in Connecticut back around 1900? Many of the towns started to recognize that there were health issues in their communities, and they wanted to try to take care of those out in the community versus in a hospital.
Who wants to go to a hospital if you don't have to,
Well,
right?
that's still true today.
Yeah.
So our agency, for instance, was founded in New London in 1909 by a group of interested folks that said, we really need somebody who can make visits out to homes to help people. Early visits were to mothers and babies. Sometimes those nurses also went to the schools, and believe it or not, we still do that. We provide the school nursing in several of the districts across our area.
Wow,
Yeah.
so the school nurse that all the kids joke about or complain about or actually like or use as an excuse to get out of class,
Yes.
that's you.
That's right, in the Groton, Waterford, New London, and East Lyme systems.
Wow.
So those nurses work for us.
Wow, that's great. All right, so obviously it makes sense where you would, if possible, there are times when it's necessary to go to the hospital or a doctor, but visiting the home, I mean, it's a novel idea. I think it's a great idea, and I think most people love it, right?
It certainly is, and what we're saying these days is we're finally coming into our own. For years, people have said, oh, everyone wants to be at home, but there really wasn't a motivation for people to be cared for in the home as opposed to in an acute care hospital. But now, the biggest payer of medical care, Medicare, is saying it's more reasonable for people to be at home. We want to try to figure out how people don't have to keep coming back into the high-cost care setting of a hospital and what can happen at home. And the answer to that is almost everything can happen at home. We do very complicated wound care, dressing changes, other kinds of treatments. You can have intravenous care at home if you should need antibiotic treatment, for instance. You can recover from your total knee operation right out of the hospital to home, and our therapist will come to the home and do the same sort of therapy that you would have if you went to an outpatient setting. So there are many different directions that home care can go, but the idea is that it is a lower cost setting, and for most people, they're much more comfortable in their own home.
Yeah, but I mean, I think the biggest thing, people would be willing to use the inconvenience of going to the hospital or the doctor if it was less expensive. But you're saying having them not have to leave the house and have the VNA come to them is actually a less expensive option, according to the insurance companies.
Certainly. The reason it usually is less expensive is even though you're in the hospital, there are nurses there to care for you around the clock, you may actually not need a nurse around the clock.
Yeah.
So you can look at home care as delivering the service when it's needed. So for instance, our nurses will just perhaps come to the house once during the day and have a plan of care laid out for you that includes your participation in the plan of care, or your spouse or a child that is caring for you. The overall organization of the care starts with the nurse going.
I just want to go back to the school nurse thing for a second. Do the kids come in with all the same issues that they had back when we were kids? Is it the same things?
Pretty much the
Yeah.
same things. I'm sure that, I mean, you said when you're referring to yourself, I know.
Because I'm 83.
Yeah,
So
well, not quite. But when I was in school, I would say that probably most of the same concerns. A lot of it is accident care, children falling on the playground. But we do now have other issues, issues around substance abuse. Those things have, creep into school every now and then. And so there are a number of hot topics. The other thing is that children with developmental disabilities and physical disabilities who might previously have stayed in another setting or not attended school pretty much do attend school, and our nurses are very involved sometime in giving tube feedings. They certainly give a lot of medications that are required at school.
isn't it, though, on the other hand, there's a lot more concern and resistance because of they're discovering that kids are more allergic to things nowadays, and maybe they don't give out an aspirin because there's a chance, that old thing.
The medications that the nurse gives out are all under doctor's orders. So
Okay.
you're right. We don't do the over-the-counter, just kind of treat children the way we think they should be treated. It's with a doctor's order and parents' permission as well.
All right, so back to the homes. What are I know you mentioned so many different services that are offered. What are primarily what people are needing when VNAs come to the home these days? Is there like a big thing?
Well, nursing is probably still the leader, but in addition to nursing, we provide physical therapy, occupational therapy, speech therapy, and social work services. And then as an assistance to that, we have home health aides. Those are the same as nurses' aides in a hospital, but we can have a home health aide come to the home 1 or 2 hours to help someone bathe or make a meal. And
Since VNAs are becoming more popular as well as nurses in your traditional hospitals, is there more of a need, especially in this area, for nurses in general? Is that a career field that people would consider going into because it's bright, the future is bright?
Well, I think the future is bright because we are looking at a demographic, as everybody talks about, the baby boomers,
Right.
who are going to want to stay at home. They're also going to, because of the numbers, they're going to use health care, and they're going to need to be more nurses. The other thing is the nursing profession, the nurses are aging. And many of us are aging out.
So they're going to need VNA services too,
we'll
right?
need VNA
Yeah.
services, and we need certainly new and fresh professionals coming into the area. We're not in a dire shortage now, but the predictions are pretty dire.
So if you look into the future, you can see there's certainly a need for more. So, and the colleges around here certainly serve. They have their great nursing courses around here.
Absolutely, and we work with both UConn and Three Rivers
Right.
nursing programs to have students come out to home care and see what that's like as a part of the nursing profession.
You can actually see, that as someone going into nursing and actually seeing that might be their specialized interest of maybe sort of going to the home as opposed to being in a traditional hospital. Maybe
That's
they would
right.
enjoy that more. Yeah.
It's very different.
Yeah.
It's very different. It's quite independent practice compared to a hospital. A hospital, if you need a little extra help, there's always someone, right
Right.
outside the room or down the hall.
You push the button and they come, right?
Right. In home care, you're out in the home and you're alone as a
Right.
provider with the patient. That has its pluses for sure. It's a very independent, self-directed nurse and therapist who are able to go into the home and do work. That being said, everything we do is based on doctor's recommendation, doctor's orders.
Right.
We also have the nurse that isn't comfortable in that kind of setting, and usually will then
Go into the home,
migrate
you mean?
away, going into the home.
Okay.
Because after that first visit, of course, you have an idea of what's there, but when you go in for the very first admission visit, you don't know, for instance, are there any dogs or other pets in the home? Are there any other situations that might be uncomfortable or dangerous? So we have a whole plan for how to handle that.
I was going to say, well, maybe the patient might be real grumpy or ornery, but then I thought, well, that could be the exact same way in the hospital bed in the hospital. So what difference does that make, right?
That's very true. And certainly people are grumpy, but for the most part, that usually is related to their illness.
Right.
And also, I would say the majority of the patients are very grateful to have someone come and give them individual care.
What was I going to ask you? When you're talking about nurses, I'm interested in the cosmetic makeup. Like, are there many men nurses these days that are getting into that aspect of nursing as well? And
Well,
do you see it more?
as a matter of fact, we've hired a few men recently. We have always had part of our staff that were men, but I think fewer men were going into nursing, partly because for many years the salaries were really not that fantastic, and certainly not in home care. That's changed. The home care salaries are competitive with other areas in nursing, and it's now at a level where it could be attractive to really anyone. I'd like to just say a minute about the fact that what we really would like to see are more minority nurses. That is something that we often have trouble not just attracting, they just aren't there.
Is there a reason for that, do you think?
I think it goes way back to who is prepared to go to nursing school, what kind of encouragement are they getting at a very young age to prepare in the sciences, in math
Okay.
in order to be successful in nursing school. So we are always kind of have our eye out for people who are from minority groups, people who speak other languages, all of that
That
is
could
helpful.
come in handy too if you have a person that maybe English isn't their first language.
That's right.
So it's a huge advantage if they're bilingual and they
Sure.
go through the nursing training.
Here in our area, for instance,
Yeah.
Spanish is very helpful. We have some nurses that speak Spanish, and it's really great because you lose something in translation when you're trying to express how you're feeling, your level of pain, that
Right.
kind of thing.
I mean, you can hear it in their voice if there is, some pain too. But still, if you can, broken English, or it's tough. I can understand that. We're going to take a break and come back. Is there a website for people to go and learn more for VNA?
Sure, there is. It's vnasc.org or www.vnasc.org.
All right. Mary Lenzini, the President and CEO of Visiting Nurses Association of Connecticut. We have a lot more to get to, so we'll take a short break and come right back. I'm Sean Murphy. This is For the Record. Stay right there. Welcome back to For the Record. I'm Sean Murphy. My guest, Mary Lenzini. She's the President and CEO of the Visiting Nurses Association of Connecticut. And you have so many letters next to your name, MA, BSN, CHC. What does it all mean? Are you a genius of everything?
Oh,
right?
yeah, well, I'd like to lay claim to that. But no, I'm a bachelor's prepared nurse.
Okay.
I have a master's degree in gerontology, or the study of aging. And the CHCE means I'm a certified home care and hospice executive.
Okay.
So it's
Does
just
that
my
all fit on a
credential.
business card, by the way?
Oh,
Barely.
yes.
Right before we took the break, we sent people to the website to learn more. What's on the website for people to see and to go check out?
Well, there's a description on the website of each of the programs that we do, a little bit more about home care, a little more about our hospice care. I'm sorry, not hospice. We don't do hospice care.
No, but it's funny that you fortunately made that slip, because that is a situation where they're going to the home. So I mean,
Right.
in so many different aspects, the medical care is going to the home as opposed to going to the hospital.
Exactly. Home care hospice is
Yeah.
a big area.
And
We
they're
have-
great, by the way.
Right. We do often refer our patients into the hospice services. What I had meant to say actually was our wellness service. Those are nurses that are out kind of all over in the community, senior centers, some of the high-rise elderly housing places here in New London and in our area, where they'll hold little clinics where people can drop in and bring their medications and say, can you help me understand these? They can get their blood pressures checked, talk about all kinds of self-care.
Preventative stuff, if
things.
possible.
Absolutely.
Yeah.
We also do flu clinics during
Right.
flu clinic time. And
I think we're at that time
yeah,
now, pretty
yeah,
close, right?
yeah. Well, we're almost finished with
Oh, is
all
that
of our
right?
flu shots, yeah.
One thing that we failed to mention, and this is a pretty good reason to opt for nurses coming to your home as opposed to the hospital. Everybody thinks, and it's true, hospital is a place where you get well, you get better, but there are also little guys called germs and bugs that are going around in the hospital that may not necessarily be at your house. It could be a safer place if you didn't want to get sick to have anything done at your house as opposed to go to the hospital, right?
That's often true, especially true for elderly.
Right, where their immune system is a
That's
little...
right, where the immune system might be a bit compromised. If there's a choice that we can treat someone at home safely, That usually is preferable. Also for people who are a little on the frail side in advanced age, when they have to relocate to the hospital, especially to be there for a few days, they often can look like they have dementia when they really don't have dementia. They just get confused at the change in their environment.
Yeah.
And so it can be pretty traumatic, actually.
All the things that we've heard today sound fantastic with the VNA. You don't have to leave your house. Come to your house. It all sounds fantastic. But in the back of people's minds, they're thinking, how much will it cost? How do I pay for this? Is my insurance cover this? So talk about that aspect of it.
Okay. Well, certainly the Medicare program, which is the largest payer for healthcare in the United States, also the largest payer to our agency because of the number of people that we take care of who are over 65. So Medicare has a very good home care program that pays for everything that is ordered by the physician. There are a couple of conditions. One is you have to be confined to your home, not be able to go out easily to seek services someplace else. So Medicare is the largest payer. Medicaid or the state welfare medicine, that also pays for home care. Private insurances, if you happen to have Blue Cross, Anthem, Cigna, those insurance companies will also pay for home care. Most of those, we need to talk with the insurance companies first to get authorization. Medicare, we can usually declare that a person is qualified and begin taking care of them when we get the doctor's order. And then about 25% of all the visits that we do at VNA SC are rather paid for through either fundraising or grants that we receive to take care of people who don't have any insurance.
Oh boy.
So they do have to meet a very easy to fill out financial guideline, but our mission is to help provide care for those who couldn't afford it any other way.
Yeah.
And so often people will say, well, I could afford partly. I could pay, $5 and not $35, and then we'll make arrangements for monies to be found within what we have. That total amount comes into around $500,000 a year. That's the free or subsidized care that we do, just our agency in our area.
We should probably mention, we mentioned a lot about seniors and Medicare because it is the pays the most out, but it's not necessarily just for seniors. Your services could be someone of any age,
Oh,
right?
certainly,
Yeah.
certainly. Absolutely any age. We probably, the one area that we may not see the most of are the pediatric patients, because when they're in the hospital or when they're ill, usually it's something their parents can care for, and they don't necessarily need our services. But there are times when when pediatric patients are referred to us.
And I should mention that as we are taping this show, we are beginning the open enrollment period for insurance, and I'm sure people have heard on the news about supposedly the skyrocketing rates of insurance. Some people maybe go through their exchange or something. So insurance is a scary thing. Even if they had insurance, they might wonder, can I afford this or any medical bills for that matter?
It is scary.
Yeah.
I would say that for the most part, we can ordinarily work things out with people. I think the one time when it becomes difficult is if we say, well, you don't have insurance, but when they fill out their financial form, they clearly have more than enough money to pay. Sometimes people just don't feel like they should have to pay.
Yeah,
but
why should I pay for my house?
Really,
I just want to live in it.
We do, of course, accept people paying full fee. That's rare, but often people who have the funds also have the insurance.
Let me just ask you, and it's kind of a rhetorical question, I don't expect you to really answer, but feel free to contribute. Why is insurance so expensive? And I know you can track it back, doctors, pharmaceutical companies, and lawyers and everything, but why is it so expensive?
It probably has a lot to do with everything you just said.
Yeah, everybody takes their piece.
And I certainly don't profess to be an expert in that, but it does have a lot to do with all of the moving parts of insurance. I think that there are a couple of things that are coming down the road that may help control costs. And again, I don't know how soon, when that will all transfer, but if you look at the Medicare program, for instance, there are new constraints in Medicare, not at the individual's end, but in the hospital, for instance. If a hospital keeps a person, too long, then they're going to overspend what is considered the reasonable amount of money available to pay, and they could get fined for, it's not exactly a fine as much as it is settling up with Medicare if their costs are too high. It can also be for patients who end up being readmitted to the hospital, possibly because they went home too soon or they were just not prepared to go home.
Is that kind of a catch-22 though? If you don't want to go home too soon, but if you stay too long, then
it is. The hospitals and home care, we're all working on what is the very best way to have the home care or the hospital care provided right time, right place, right amount to make it all work. And Medicare, with some of their more recent and kind of complicated rules, are forcing us to take a closer look at that. I would like to think of that, instead of it being something imposed on us by Medicare, as a way for us to really think seriously about where is the best place for the person to be to receive the health care. And certainly going back and forth to the hospital isn't good for anyone.
Right.
So we need to make a plan so when someone is ready to come out of the hospital, home care or a nursing home, we're ready to receive them and provide the appropriate amount of care. So there's a lot of work being done along those lines these days.
From your point of view, what you do for a living, do you, Medicare, is it viable into the future? Because there's always like that concern about it. What do you think?
Well, I would like to think it is, since I'm a card-carrying Medicare person. I'd like to think that it's quite sound. But again, I think much of that is kind of in the political realm.
Yeah.
We really, I don't know if any of us really know.
I don't know if you knew, but it's an election year. But
I think I've heard something about that.
I want to mention that VNA is affiliated with Lawrence and Memorial, which is now affiliated with Yale. So can you talk about that a little bit?
I certainly can. We've actually been affiliated with L&M since 1994. And it's been sort of a silent partnership in taking care of people in the community. And the advantage has been, in a way, having that good housekeeping seal of approval that the hospital affiliated with us as a strong home care partner. But the affiliation with the Yale Health System is exciting, I think, all the way around. For our agency, it's very exciting because Yale doesn't have any other home care company or any other visiting nurse association. They work with many in the community, but they now have one, us, in their system. So we're looking for the opportunity to really develop some good programs along with the partners across the whole system.
You're going to need some more nurses, I think, right?
Well, that's just might be.
So someone's watching and they say, you know what, I think that I might be a candidate or a family member could utilize the services of VNA. What should be the first thing they do if they want to do a little research or want to have questions answered?
Well, they can certainly call our agency to ask questions. We have an intake nurse. The intake nurse is usually the best person to talk to because she can answer lots of questions about insurances and what steps have to be taken before a person's admitted. And we have just one phone number for intake and one phone number to reach me. It's all the same. And it's a really easy to remember number, 444-1111.
Is that what
That's
area code?
860,
Okay.
area code 860-444-1111.
If someone's calling from a different part of the state, you could steer them to the appropriate services to
Certainly,
utilize for them?
Yes, actually our receptionist has right at her fingertips books that have listed all of the agencies, not only in Connecticut, but in the nation.
Outstanding. One more time on the website for people.
www.vnasc.org.
Mary Lanzini, President, CEO of the Visiting Nurses Association of Connecticut. We learned a lot today. Thank you for being on the show today.
Thank you very much for having me.
You can see this show and many others on our YouTube site. Till next time, I'm Sean Murphy. This is For the Record. Take care.